Hi, everyone. I'm the director for our registered New Zealand not-for-profit Common Knowledge Trust, and we've always been privileged to hold the concept that hundreds of fathers and mothers developed in the early 1970s in the U.S., which is a simple concept. It's an idea that has words and then is followed by actions. So the words are simple. When you're pregnant, it's just normal and natural to self-learn some form of birth and birth coaching skills and then use those skills to work through the activity of birthing your baby. Simple concept. Nothing that we've had really for the past 40 years. Who knows? The other is we hold all of the birthing better skills. Birthing better is one of the skills-based methods that would fit into that concept. If you want to learn Lamaze or Bradley, Grantley Dick Reed, hypnobirthing, birthing within, calm birth, any of the skills-based methods you know, along with birthing better, go for it. Just learn some skills, for goodness sakes. Now, I find myself 50 years into this childbirth conversation, having a bizarre set of conversations with several people at this point, which has sort of driven me online even further than when I came back when COVID hit. And why am I coming back to talk about these important things around the conversations around childbirth? Because where do we go from here? When I gave birth in the United States in the 1970s, there was a very high societal expectation that everyone learn birth skills. Those were the first and only childbirth preparation classes taught, Lamaze and Bradley. They were all skills, 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 skills. Not the greatest, couldn't adapt, weren't adjustable, weren't sustainable. They were focused on having a natural birth, pain-free labor, go figure that one, and no medical care, go figure that one as well. And nobody defined the word natural, and it hasn't been defined since. So birthing better families just developed a greater range of skills. And then skills were replaced with choices. Rather than going together, which made sense, choices are what you want and don't want. Skills are what you do. We're going to talk about that. But no, it was choices. To say no to medical care. It wasn't about saying yes to more medical care, but why not if you want that? So in the conversations I'm having with several people, really some of these issues have come forward again, and now we have social media. So today I'm going to talk about childbirth terms and what they mean, because this is an important conversation. If we don't know what we mean, and if we can't all agree to what we mean, then how do we ever do anything? Just take politics. I mean, goodness. And childbirth is extremely political, and I have avoided that like a plague because I am not interested in the politics. The families that develop birthing better, maybe they were, maybe they weren't, but mostly we were just interested in our baby's birth. So we developed skills so we could work through the activity. So let me talk about these words in order. What does natural birth mean? What does it mean to you? Think about it. Does it mean safe, good outcome, manageable, at home, with a midwife, in water, highlight experience, orgasmic? Does that mean to you? Or does it mean anything that could happen might happen? Is it natural that a woman tears through her rectum? Is it natural that she bleeds excessively? Or is it natural that she suffers because she can't cope with the pain? Think about, what does the word natural birth mean? We throw that around as though we've all agreed that it's the former. Just easy, it's a no-brainer. We have to ask, is that accurate? And the answer is no, it's not accurate. Natural birth means anything that might happen could happen. And we have to be very clear about that, because if we don't speak the truth about it, then we do very little to get empowered through our experience. So what does the word normal birth mean? Is it normal for a baby to die? Is it normal for a baby to get stuck? Is it normal for a cord to prolapse? Is it normal for a woman to get into a position unknowingly that hinders the process of her birth? Is that normal? Or does normal mean, well, shucks, gosh darn, don't we know women have always given birth? So we all just know how to birth and we just cope fine and everything's just hunky-dory? Or a normal birth is only one that has no medical care? Or a normal birth is one that, what? What's a normal birth mean? What does it mean to you? So once again, if we're not honest about the meaning of these words, then some women are going to be very fortunate to have very easy births that appear to be just normal and natural. And they are, because some women just easily birth. And they have a good outcome and they cope brilliantly. And they could birth standing on their head or in the middle of a war zone, and the baby would just come out. So what's a physiological birth? Because natural and normal got replaced by the word physiological. And by the word spontaneously physiological. So women aren't supposed to push. They're supposed to wait until they have this ejection reflex. Well, that's fine if they have one, if they don't have one. Is it physiological that they don't have one? Sure. Is it physiological to have twins or a breech? Sure. Is it physiological to have early ruptured membranes or a temperature? Yep, it is. But physiological was meant to replace natural and normal. And in New Zealand, I think in 2005 or somewhere like that, there was a midwife who looked at midwifery notes. And the question she was asking in her research is, how are midwives defining normal and natural? And it was anything except a cesarean. So any type of assessment, monitoring, and procedure, if it ended up with a vaginal birth, was considered to be normal and natural. And the professional organization went into freak mode. That wasn't what they meant. What they meant were the goals of those first skills-based methods. Natural birth, implying good, easy, good outcome. Pain-free labor, although they were willing to admit that wasn't probably one of the realistic goals, without medical care. That was a big one. Because when I teach strengthening the partnership workshops on behalf of our trust, we ask the New Zealand midwives, what do you want for New Zealand women? It's more natural births. That's what they want. What's stopping that from happening? Interventions. Make a list. 20 of them. Okay. So a profession is saying to the general population, we want you to have this type of birth. And in order to achieve that, you have to avoid 20 things. That's not realistic. Makes it hard. It's very hard to do this. I can't tell you how many thousands of women have said to me, I planned a natural birth, but I didn't have one because I was induced or my membranes ruptured. I couldn't get out of bed, right? Or wasn't allowed to eat. Right? Oh, sad, really, isn't it? So after this midwife had done her study of midwifery notes, the midwifery profession in New Zealand decided to use the word physiological, that there should be this spontaneous physiological process. So what do we do with those 72-hour labors? What do we do with the women who don't go into labor within 42 weeks? What do we do? What's physiological mean? A woman pushing for 6 hours because her midwife could hear and intuit that she was fully dilated. And then, no, she wasn't. What do these things mean? if we don't understand what they mean, if we can't contextualize them in reality, and who are we contextualizing them for? 100% of pregnant women are going to give birth. So let's look at choices. That was the darling of the 80s and is still what people are going by. You know what kind of birth you want. So just tell your birth professionals, because they're serving you, you're hiring them. And so when you hire someone, they should give you what you want. Well, that goes for a wedding planner. How's it doing for birth? Babies come to plan? How many people have had the birth they envisioned? There's no way to know what your birth's going to be like. So what are we actually planning? Well, the planning actually was to say no to medical care. That's what was wanted by some birth advocates. Women should be able to say no to medical care. So when we think of choices, how do you know what you want and don't want? Oh, you might want frills, this music, or these people with me, or to birth at home or in the hospital or birth center. You may want to be left alone or to hear pretty music. But how exactly are you, unless you're trained, to know whether you should be induced or not, whether your membrane should be ruptured, whether your labor should be augmented or left alone? How do you know those things? Why do we go to professionals? So think about choices. What are we actually choosing? If there's no way to know what our birth's going to be like, how do we then deal with a birth that doesn't eventuate the way we want it? Important conversations. What about skills? When I gave birth in 1970, we were all in the U.S. learning Lamaze and Bradley. Multiple millions of us over a generation did some sort of panting, blowing, breathing, trying to relax, working with our husbands who were coaching us and timing our contractions, breathing with us. They may not have been the best skills in the world, but damn it, they were something. Because throughout time before that, women didn't have any skills. Yeah, there are people who think that traditional women had skills, but I've been very fortunate to be in about 30 traditional cultures, not involved in birth, involved in other things in my life. None of them pass on breathing or relaxation skills. They all have things in pregnancy to try to reduce or prevent problems. They all have things with newborns and mothers after the birth to protect them. But birth, there's no way to know what your birth's going to be like. So skills are very important, and I've done another one on what exactly are skills in childbirth. We breathe all the time. Why not have good breathing skills? Our body's in some posture or position. Why don't we know how to help our baby navigate through our body? Or how about, why don't we know how to prepare our body to create space and open up for this big object? Or how to recognize whether our labor is progressive or not progressive and then do something to help it be progressive. Or what do we do when we have niggling, non-progressive early labor instead of getting tired? Well, it's normal and natural and physiological to have pre-labor that goes on for a week or a half. But why don't we have some skills wrapped around it? We do. But not very many people know about birthing better skills. So skills are many. Preparing the inside of your vagina. Why do you want to possibly tear or delay the baby's birth? What about positions that may be gravity plus, but block off your pelvis, like a semi-recumbent position? Or even walking because you weight bearing and your muscles get tighter in your pelvis. Why don't we know these things? Why aren't we talking about them? And that goes down to the birth plan. You can tell people what you want. It's fine. It's nice that they know. How about writing a skills-based birth plan as well, about what they're going to see you do? Because you can plan your birth all you want, but one day it's going to unfold. It may unfold as a non-laboring cesarean, but when you get in a transportation to the hospital, that's your labor. When you're being prepped, that's your transition. Surgery is your birth. It's the activity you're doing with your baby as a parent. Why don't you want to be skilled to do this activity? Why are people not telling you to be skilled? Why is your birth plan about what you want and don't want, and the choices you have, and not about the actions or how you're going to do it? Doesn't that make sense? It does to us. That's why I'm creeping out of my hole and trying to say to people, we've got to change the message in childbirth. We've got to re-envision it. And I did another video on that, re-envisioning childbirth. We absolutely must put this concept in place, that it's normal and natural when pregnant to self-learn some skills and then use those skills to work through the activity of birthing your baby. Why? Because after your baby is born, you're expected to be a skilled parent. Your baby's with you already when you're pregnant. Be a skilled parent. So now let's talk about the hard things, risks, problems, and tragedies. There are risks. I mean, look at COVID. Let's just take COVID. It's a risk. Right? 2 to maybe 15%, there was no medical care, would be dead. It's a low, small percent. Childbirth is probably not dead, it's small. Tragedies, dead. But there are other tragedies. This isn't the only one. But there are few tragedies in childbirth. Same with COVID. But COVID's highly infectious. So that means just by the numbers, there are going to be more tragedies. And there are some long-haul problems now, aren't there? So even though there are a few tragedies in childbirth, there are many more problems. But most problems either get fixed through medical care or they self-resolve without a tragedy. So a woman can bleed heavily, but it doesn't mean she bleeds to death. Risks. Heaps more risks than problems. Few risks become problems. And most risks may not even be identified. But if they are identified, how do you you just let them go? It's natural and normal and physiological. That's what it was like when I gave birth in 1970. Risks were natural, normal, and physiological. They didn't have anything, they couldn't do very much about them. Then by the 80s and the 90s, the ability to make assessments, monitor, and procedures was much greater. When I gave birth in 1970, there were x-rays. There were no ultrasounds. You'd listen to the baby's heartbeat with a stethoscope or Panard periodically. If there was a tragedy, it was considered normal, natural, physiological, and accepted. Not anymore. Risk-averse consumers. You got to be kidding me. So if you have a risk, how exactly are you going to prevent that from becoming a problem? Which brings us to the next one. Who's a professional? What's their responsibility to you, whether it's an obstetrician or a midwife? Their responsibility to you is to know more than you, right, about the risks, the potential problems, and to do their best to safeguard the health and well-being of you and your baby. That's why you go to them. Go to a car mechanic to fix your car. If you knew how to fix it, you'd do it yourself. We use professionals for a lot of things. And we go to professionals because they have skills we don't have. But that does not take away our responsibility. And in childbirth, it shouldn't take away our responsibility. And what should be our responsibility? Well, from our viewpoint as a trust, your responsibility is when you're pregnant, you should self-learn some birth and birth coaching skills and then use your skills to work through your baby's activity of being born. No matter where you birth, no matter who's present, you have to do it. Us women, we do it with our baby. No matter what our circumstances, no matter our beliefs, no matter our choices or lack of choices or change of choices, no matter what happens to or around us at a birth, it is our baby's birth. We are doing it with our baby, and we do it alone. If there are 100 people there or not, if we like it or hate it, if it's unfolding the way we want or nothing like it, if nothing that we wanted is happening and everything we didn't want is happening, we still have to do it. That's not unlike parenting. How many parents have 100% wonderful days with their kids? Oh, come on, get a grip. What's your responsibility when you go to work? Do your job. Learn the skills and use your skills to do your job. Giving birth is your job. Nobody can do it for you. And we do not have a childbirth conversation that tells you that. We just have a childbirth conversation that says, well, you know what you'd like it to be. And no wonder we have such a rise in shame, blame, guilt, disappointment, anger, frustration, and perceived birth trauma. I didn't get the birth I wanted. They were mean to me. They imposed things on me. Yep, they do. Yep, they do. Not every care provider is nice. And some care providers are so nice they're sloppy in how they care for your health and well-being. So if we want to reclaim childbirth in the now and in the future for our children, then we have to think about what we are doing with professionals, whether they have a partnership relationship specifically defined, like in New Zealand with midwives, or not. You are in partnership with them. You have to do the birth. They are doing the assessments, the monitoring and procedures, whether you like them or not. And when you call them those things, assessments, monitoring and procedures, interventions, with the implication that those are imposed on you and unnecessary, then you're going back to those words of normal, natural, and physiological and treating them as though they are a nothing burger. And if they are a nothing burger, then you are denying the reality of what childbirth is. It is a one-off, infrequent, life-transforming, incredibly dynamic, and dramatic experience that can have lots of risks. Not only can lots of people have risks, one person can have multiple risks. Thankfully, few become problems. But if you're not making some assessment, some monitoring, then you do not know. Is how the medical profession assessing and monitoring the best way? Don't know, don't have a clue. It changes. I'm old enough to have lived through 3 evidence-based systems. That's crazy. Crazy. When I gave birth in 1970, I was given an enema. You're not. I was shaved. You're not. I was strapped to the delivery table. You're not. So when we look at our responsibility, and that's what Birthing Better Families in the early 70s were saying, we have to become more skilled. The skills that are there now sometimes work, sometimes don't work. We need something better. And we need skills for all of our births. Our baby's birth is important to us. We may want X birth and get Y birth, but it's important to us. It's what we are doing as parents, and we want skills to do it. So our responsibility, go back to the concept, when you're pregnant, learn some skills, then use those skills. Will you have a perfect birth? Don't know. Will you feel more empowered because you use some skills to do the activity of birthing your baby? Of course you will. Why? Because whenever we use skills, any time in our life we feel better, particularly if the situations are challenging. So this brings us to what the word instinct means. You walk down the street and suddenly you feel, boop, something, and then it falls. Right? That's instinct. We cannot do that for hours and hours and hours and hours and hours. When you see beautiful women on YouTube that look so serene, people say, oh, she's using her instinct. No, she's not. If you go and talk to these women, they will tell you, I'm using skills. How do they say it? This time I really focused on opening up. This time I really relaxed more. This time I didn't get into labor as fast, so I didn't go into labor tired. This time I really focused on calming my breathing down. That is the application of skills. The only difference is we don't have a message and haven't had a message for 40 years, and those women aren't likely to know how to pass those skills on to other people because you never know what your birth's going to be like. And that's why, in some ways, Birthing Better Skills is so unique, because we had to learn skills in a way that we could all adjust and adapt, and they were universal. For instance, when we go through breathing, we go through the 4 ways we breathe: in the nose, out the nose, in the nose, out the mouth, in the mouth, out the nose, in and out the mouth. But if we pick each variation, say, how do we use that in life? We do change how we use things. So, for instance, in the nose, out the mouth, when we exercise, when we have sex, when we moan, when we scream, when we relax, when we focus, relax. We all do those things. So which one would you use as a skill to cope with pain? And which one would you be using if you were just reacting? So when you couple skills, you enhance that ability to be instinctual if necessary. And should we trust birth? Well, trust that 100% of pregnant women are going to give birth. If you're believers that birth is natural, normal, and physiological and everything's hunky-dory, and you trust that, and what happens if that's not true? This is coupled with don't be afraid of birth. So I'm going to tell you what I've learned over 50 years. Every culture around the world is afraid of birth. Humans are hardwired to be afraid of birth because we don't have medical care most places. We have to rely on ourselves. And so what does fear do to us? Doesn't matter whether we're pregnant or in birth or after our baby's born or any other time in life. What does fear do? It primarily helps us to become observant. And why is that important? Because then we can look at something and say, is death going to occur right away? I got to get help or do something. Or is death going to occur, or severe injury going to occur pretty soon? Then I'm going to get help or do something. Or should I just be observant and just watch? Now I see everything's fine. Imagine how that helps you as a parent with a newborn who can't talk to you. To be able to look and go, something the matter? No, I don't think that baby's going to die or be injured in 5 minutes or shortly. So I can just calm down and thank you for this gift of fear that helped me be more observant. So when we, as women, tell each other, don't be afraid of birth, women have always birthed, that goes into that school that natural, normal, and physiological is just hunky-dory. And just tell your care providers what you want, and they should give it to you. So what do we think about modern medicine? Love it, hate it. It's a scientific method, right or wrong, good or bad. Right? But it's a method and can be applied to anyone. And let's talk about that in relationship to natural birth movement. That's a philosophy. It's a belief system. Why have we pulled them apart? Why have we identified 20 assessments, monitoring, and procedures, implied that they're interventions that are imposed and unnecessary, so that if women are in medical care, either by choice or requirement, because they have risks that need to be assessed and evaluated, why is it then so hard for us to have an empowered birth? If we're laboring, it still goes on, whether we're wired through every single one of our holes or not, whether we're induced, augmented, it's still going on. We still have to do it. That's why we need skills. That's why we need that concept to be enlivened. We need everybody to become skilled. We need you to pass that on. We have to stop bullshitting around childbirth. It is that important. When women have perceived of poor birth experiences because they didn't get the birth they wanted, that infects their family and themselves. We don't want that. When people use skills in every one of their births, they always feel better. That's what my generation discovered. Multiple millions of us. That's what labor and delivery nurses and obstetricians saw. We were all coping better. We weren't suffering in childbirth. And we felt empowered. And we want that to happen again for you. So let's talk about midwifery care, because in the 70s, midwives were different than doctors. The United States, they were outlawed in the 1950s. Very few cultures have midwives. Mostly it's your aunt or your mother-in-law, or your grandmother, or anybody. There's some cultures that have them. Most cultures are quite small. So if you're a midwife, if you're attending births, maybe you'll attend 1 to 7 births a year. And they're people you pretty much know. Did you apprentice? Unlikely. Mostly you just ended up accidentally at a birth and then decided you'd go to another one. So we have to take a look at what midwifery care is all about. Midwives have been frantic to distinguish themselves from doctors. New Zealand midwives, when I immigrated there, 95, had taken over maternity care. The government said, sure, you can have it. 1990. They were autonomous. They're still autonomous today. They didn't want to be midwives. They wanted to be real midwives. And a real midwife was one who obviously did home births. So what about all the midwives that have been integrated in every country around the world, with the exception of the United States and maybe Canada, forever in the maternity system? Well, there wasn't continuity of care. And women everywhere around the world, I've asked tens and thousands of women, would you like to see the same care provider in pregnancy who's going to be at your birth? They all say yes. They would all like that. They don't care if it's an obstetrician, general practice doctor, a midwife. They do not care. They just would like the same person with them. And they don't care after the birth. They just want somebody to clean and cook, do the laundry, take care of the kids, let them sleep. Right? That's really what they want. But midwives set themselves up as not only attending births, but attending to all of women's needs. Why is that? If we think, or if you think, that birth is normal, natural, and physiological and a no-brainer, all you need to do is tell people what you want and get it, why do you have to give women so much care? We're adults. As soon as we get pregnant, we're a parent. We have to parent after the birth. You're not around parenting with us or helping us with all the other emotional, physiological, relationship, financial needs. Why are you doing that in pregnancy if you see yourself as distinct? If you see yourself as not medical, why are you going to school for years? And why, if you have a partnership with women, do you think that women don't need to be skilled to do the task that they have to do? You're there to safeguard their health and well-being, but you don't do the birth, no matter how much time you give them. Even if you come when they want you to be there, why do you even do that? If families aren't skilled, and there's a belief in midwifery care that midwives should sit in a corner and knit, and a belief by a famous obstetrician that women should be left alone to discover birth by themselves, then why are you there? You have your life. You have your family. What are you doing? And what are we doing together? As women, what's the message we're giving each other? That a few people are successful and the rest of us fail. And we have to change that. I'm the director of a trust called Common Knowledge. We believe you should be able to use any and all health systems that you want without prejudice. And we hold the skills that Birthing Better families developed in the early 70s. And the concept is a simple sentence. When you're pregnant, self-learn some birth and birth coaching skills and use those skills to do the activity of birthing your baby. It's your baby. You have to do the activity. Become skilled. And we also hold a skills-based resource as online classes, Birthing Better, that fathers and mothers developed. And if you think, oh yeah, fathers. Yeah, well, fathers, those men in our lives, they see birth from the outside. So when women are saying, those contractions weren't painful and now I'm out of control from the pain of those contractions, men are seeing that the contractions start, they begin to intensify, they peak or they plateau, they begin to go away, and therefore they can see that instead of just treating it as pain or no pain, they treat it as 5 opportunities to use skills and work together with their partner. Aren't you glad that men are seeing birth from the outside? When we're inside the experience and we feel that those labor contractions are going on and on and on the same way, and that man or woman now is outside us going, that labor is not progressive. I wonder if it has to do with the position she's in. Or maybe she's blocking her body. Or maybe she's bending in a certain way. Or maybe she has internal tension. So let's figure out how to create space in that pelvis. That's what fathers brought to this. The capacity to see this from the outside and this intense desire to help. When they do the internal work on us, what do they think? Do they think sex? No, what they think is, this is coming out of her. I don't want this or her to be damaged. And my role as a father and a partner is to do the internal work so that the tissue inside a vagina is soft and pliable and will open up when the contractions bring this baby down. Because if that was coming out my penis, I'd like her to help me too. So I've gotten pretty much everything off my chest at the moment. Okay, I forgot the word interventions. Okay, so we'll go that quickly. Assessments, monitoring, procedures are now labeled interventions. It's implied that they're imposed on you and unnecessary. If you take all of those away, how are you going to determine if there's a risk? And how are you going to determine if a risk is going to become a problem? And how might you solve the problem so it doesn't become a tragedy? And that goes back to how we use the words normal, natural, and physiological. So I hope this has been educational for you. Pass it on, subscribe to our YouTube channel, tell other people about these conversations. They're very important to have. We need more skilled families. So talk to you later. Bye-bye.